You're listening to Mr. Medicare with Harold Solomon on the True Oldies channel 95.9 FM and 106.9 FM. Reach the team with any Medicare-related question. Now, here's Mr. Medicare.
I want to welcome everybody to the Mr. Medicare show. It is Thursday, October 14th, 7 p.m. Eastern Standard Time. I don't know about Matt, but I know I'm excited because this is the time of the year when we get to work. We get busy. This is the time Rich, who has been running around behind the scenes, preparing all the agents, getting everything ready, getting all our practices and our forms and our formats and the agents ready, tuned up, ready to go. This is game time. So
literally getting emails and text messages and calls as we speak.
We're in crunch time. So the annual enrollment period starts tomorrow. You're listening to the Mr. Medicare show. My name is Harold Solomon. The Mr. Medicare show is brought to us by the Senior Health Desk, 844-607-7283. I'm joined by Matt Munster, one of the principals at the Senior Health Desk. Now, I really don't have to ask you what's going on at Senior Health Desk because I know this is like crazy because starting tomorrow, annual enrollment period starts and we're going to be ready to go. Agents waiting by the phone tomorrow morning.
Yep.
We're gone.
Yep, so basically it's just a continuation, so just last minute things, getting shored up, making sure that we're all good to go and everybody's trained up on all of the changes. And then for our audience, what we've been doing is booking appointments, gathering initial information, making sure that we know what doctors you want, what medications that you take chronically, what it is that you're looking for in your plan. So that way we can go and kind of do a little bit of homework for you behind the scenes before October 15th, tomorrow rolls around, and we can actually start doing the enrollments.
I'm going to start off by saying, especially with the annual enrollment period starting tomorrow, I need to let everybody know that as licensed certified Medicare specialists, there are certain things that we cannot discuss on this radio show. Medicare has certain guidelines that we must follow. I'll do my best to answer questions during the show. However, if your question falls into an area that we cannot discuss on the air, we will call you and schedule a phone appointment so we can answer your questions.
Yeah, we help people all over the United States. Tell all of your family and friends to join us every Thursday at 7 p.m. Eastern Standard Time. And you can also check out our YouTube page. Just type in Senior Health Desk, like your physical health, Senior Health Desk on YouTube. Our goal is to help as many people as possible. If you have a question but you don't want to call in, call the Senior Health Desk at 844-607-SAVE. That's 844-607-7283. If we are on the phone, which we're going into the busy season, please leave a detailed message. We get back to everybody. We won't leave you hanging. Now, many of you have listened to the show, called or emailed with questions, visited our website and our YouTube page, and have scheduled an appointment for the annual election period that starts tomorrow. I just wanted to take a moment and thank everyone for listening to our show on iHeartRadio or watching on YouTube. We do this for the Medicare community, and it's been great working with everybody. And I appreciate you guys working with us to make sure that we do this in as an efficient way as possible. So thank you sincerely. We couldn't ask for a better audience. If you haven't scheduled your appointment for AEP yet, we're still taking calls over the phone. Just give us a call at 844-607-SAVE. That's 844-607-7283.
If you're just tuning in, you're listening to the Mr. Medicare show. Please join us every Thursday at 7 p.m. Eastern Standard Time. As Matt just said, if you have any questions, give us a call to Senior Health Desk at 844-607-7283. You can check us out on Facebook, or you can also check us out on YouTube. Just look for Senior Health Desk. So what we decided to do for tonight, since we're all ready to go, Rich is running around, he's fit to be tied. He wants to help as many people as he can. All of our agents are all primed and ready to go. We've been getting a lot of questions come in, people calling, people emailing us. One thing I wanted to kind of caution everybody was not to procrastinate with this, because you hear October 15th to December 7th, and maybe in your mind you say, oh, I got plenty of time. But as we said in last week's show, the mail isn't going as quickly as it used to. It takes time for paperwork to get done, for you to get your information to check. So please don't wait till the last minute. Now, we got a call the other day. Someone said, how much time do I have left? When does the annual enrollment period start? So let's start with that. The annual enrollment period starts tomorrow.
October 15th.
October 15th. Another question people ask is, how do I make sure if my doctors are going to be in the network?
And that's a big one. That's a big one.
It's very simple. Our answer to that is you have to tell us what doctors you're looking for. I don't know. I have people call me up and say, oh, I just want a plan that I can use for all my doctors. And I go, okay, now you got to tell me who your doctors are. And I have to get their name and their address, because we have to look them up. Whatever plan you may be interested in, or if we have suggestions for you, when we look all these plans up through our resources, we have to know the names of your doctors, because we have to check. We might find you a plan, or you may give us a name and say, my friend so-and-so, and we get this a lot. Everybody has friends. My friend has this plan.
Right.
But
Yeah,
their
we do get that a lot.
friend, forget being in the same county as you, they're not even in the same state, and that plan could be completely different.
And even if they were, if you had a twin sister that lived in the house next door to you, chances are you guys are the ideal plan for you is not going to be the same, because if you're taking different medications, seeing different doctors, have different needs, different wants as far as all of the value-added benefits and extras that can come with a lot of these Advantage plans, then it's going to be different than even your twin sister. So it's very, very much tailored to the individual. And I just want to talk about the doctors being in network, and this is just kind of a little tip that I want to share with the audience. So these plans, Advantage plans, are all networked-based plans, and we can always look for a PPO, and that gives you some out-of-network benefits. But let's say you have 5 doctors that you see, right? If your insurance agent has to make sure that all 5 doctors are in network, and listen, that may be the case, then it's going to limit your plan options. Right, because now we have 5 doctors. We need to make sure that all 5 doctors are in the plan. Okay. Now, if you have no doctors, and this is like a dream as far from a Medicare Advantage, insurance agent, I guess you would call her, a Medicare specialist, it makes it really, really easy. Because if you don't have a primary care physician, and you don't take any medications, and you have all of these plan options, right? It doesn't matter. Now we can really, you have the full boat to choose from. And there's a middle ground with that too. And this is kind of the point that I'm trying to make. So let's say you have 5 doctors. Out of the 5 doctors, 3, you love those doctors. You've been going to them for years. Your family's been going to them, right? You have a relationship with this doctor, or maybe this doctor helped you get through a really difficult medical situation, and you're like, I don't want to keep this doctor, right? And I'm sure you get that a lot too, right? Let the agent know, like, hey, these are my must-have doctors. Like, deal breaker, I will not change plans. These other 2 out of the 5, though, if I have to find a new doctor and it means, me saving a bunch of money on medications, or getting extra dental benefits, or, lowering the cost of my copays, or eliminating the deductible, right? There's a lot of different things that we can do to help find you better Medicare plans. Let the agent know, like, hey, yeah, I do see these doctors. If they're a network, great. If they're not, that's okay. Just help me find a new doctor. We can help you do that. We'll send you a whole list of doctors for whatever category or specialty they're in that accept the plan. So I just wanted to put that out there, because if you are willing to be a little bit flexible with your doctors, and I do understand, and I just want to make this clear, there are situations where you should not be flexible with your doctors, okay? Just want to put that out there. I completely understand that. But if you are in a situation where, you have a couple doctors that you can take or leave, it may end up expanding your plan options and ultimately save you money.
That's a very important point. I do have sometimes clients with multiple doctors, but I'll ask, I say, well, how often do you see these doctors? And like the 3 out of the 5, they see 3-4 times a year because they have specific reasons. But sometimes the doctor 4, doctor 5, I see him once a year. Maybe I don't need to see him at all. So as long as you have a little flexibility, that allows us to be in a position to help you even more. One of the most important things I always tell all my Medicare clients is we need a good, up-to-date list of your prescriptions, because this plan is going to go from January 1st, 2022 to December 31st, 2022. Every prescription that you give us, we have to make sure is covered by whatever plan that you might be interested in or we may find that's available to you. But this is sometimes even more important than the doctors. And I'm not making light of, seeing a doctor, because that's very important. It's a one-on-one connection. But sometimes people think they're afraid of the change, but sometimes you can find a much better plan, and that's to your advantage.
Yeah, absolutely. And it's funny that we're talking about this, because this was literally our training this morning with our agents. One of the very, very first things that we do when we're looking at different plan options for you is we look to make sure that you have proper prescription drug coverage and it's competitive in your area. So long story short, save you money on your medications. Now, the reason why that kind of takes the forefront, right, and we put that right at the first part of looking at different plan options, is because, listen, I've seen some really high prescription drug costs, and for the cost of some of these medications, there's not enough dental that you can get on a plan to justify having to pay hundreds, if not thousands of dollars more for your medications. So, all of these extras on these plans are great and really helpful, and they help keep you out of the doctor. And if you're on an Advantage plan that has these value-added benefits, I highly recommend use those value-added benefits. They're there for a reason. Gym memberships, over-the-counter allowances, transportation, preventative care. It's all there. But none of it really matters if your medications are ridiculously high, to the point where, you can buy a gym membership, So the very first thing that we do is we look to save you money on your medications, and then the rest of it follows that. So the medications, and listen, you may not be taking medications, right? And if that's the case, we skip over that part. We get right into the fun stuff. Okay, who's your primary care physician? Are you seeing any specialists? If you're not taking any medications, you're probably not seeing any specialists. I could be wrong in some cases. So then it's just about, cool, what kind of extras do you want in your plan, right? And obviously going over the copays and stuff, but yeah, we always start out with prescription drugs, and sorry for getting long-winded on that one.
It's all right. For those of you that might just be tuning in, you're listening to the Mr. Medicare Show. Join us every Thursday at 7 p.m. Eastern Standard Time. If you have any questions, call 844-607-7283. You can also check us out on Facebook, and you can also go to YouTube and just search for the Senior Health Desk. What Matt was saying before, and I want to let everybody know, is extremely important. I get so many calls. People say, but I saw something on TV, or a friend said you get everything, it doesn't cost anything, and you're not going through the actual nitty-gritty of your plan, and it's with the prescription drugs. I've had so many people call me up and say, but I'm paying so much for this, and I'm paying so much for that. So this is a very important part. And once we get that done, we're going to look through every plan that's available in your area to see if it has dental coverage, if it has vision, if it has hearing. But not only if it has coverage, is it minimal coverage? Is it comprehensive? Sometimes people say, oh, whoever they spoke to last year said, I have dental coverage. But what they think in their mind is dental coverage. It's not what actually is on their plan. Their plan could have dental coverage, which is 2 free cleanings a year and a set of x-rays.
Right. And then you want to be careful too, because I know that like one of the tools that agents use is like Medicare.gov to search plan options. And one of the things, and Medicare, if you're listening, that I have issue with the website is when you're going through.
He said it.
It's okay. If I'm going through, to look at the value-added benefits, and it says, dental, comprehensive dental covered, and it says yes, but then I go into the actual plan benefits, and it's like, yeah, it includes extra dental, but you got to pay $25 more to get the dental that comes with the plan. What I think is happening, because I've spoken to Medicare beneficiaries that are like, oh yeah, the agent told me that this plan included dental, because it says comprehensive dental covered, yes, right? But they don't know that it's an optional supplemental benefit on the Advantage plan that they need to pay extra for. So they start January 1st thinking they have dental, and they don't.
That's one of the reasons Rich has been running around, and I know you've been with all our agents, because we are completely transparent.
Yep.
We want
for
everyone
better or for worse.
We want everybody to know, if this is the plan that we feel is best for you, you're going to know why, and you're going to know exactly what your benefits are. Keeping in mind it's a very difficult job we have now, because we literally have millions of people that during the annual enrollment period have the opportunity to change their plan, and county to county, state to state, East Coast, West Coast, everything is completely different. It is definitely not a one-size-fits-all plan. I also get calls from people who, I guess you could use the word, they're angry, because they say it's October 20th, it's October 23rd, and they've been getting call after call after call after call after call from someone they don't even know where in the world they're calling from, and they're getting stuff in the mail. We're just telling people, I guess you just tell people, just think a moment, be aware of what's going on, who you're talking to. Everyone at the senior health desk, we are all licensed, certified Medicare specialists. We've gone through all the classes. We've taken our AHIP tests. So we've gone through the ringer, as it were, with Medicare. So just give us the opportunity to actually be there to help you. Also, we ask people, are they paying cash for their prescriptions? Are they paying, people get other things. They get vitamins, they get toiletries, and there's some plans I've been seeing now that are even going to have, and some of them fairly extensive, over-the-counter benefits. Well, we're not talking $25 a quarter. Some of them are saying you're going to get, I guess they send you a list to choose from, and it's like up to $100 a month in some cases.
Yeah, especially the dual special needs plans. So that's those are plans that are there for people that are eligible for Medicare and qualify for Medicaid, so low income. So you have basically two government programs rolled into one plan, one Medicare Advantage plan. It's called the dual special needs plan. And it's not always the right choice. Just because you have Medicare and Medicaid, it may not be the right choice. But if it is, the value-added benefits are usually really, really, really beefed up. Like I've seen, and I don't know if I don't want to say the exact amount, but a lot more than a typical Advantage plan as far as over-the-counter allowances.
And one thing Matt brought up, and I want to take a moment and elaborate on, is we unfortunately have a large population of Medicare-age folks who do have certain chronic situations, whether it's a heart issue or COPD or whatever may have happened to them over the course of their lifetime. And these special needs plans are available, and they have these added benefits for that specific group of people to meet their needs. So if you fall in that group, you've got to communicate to us, and you have to let us know what's going on in your life and what's happening. If you're just tuning in, you're listening to the Mr. Medicare Show. Join us every Thursday at 7 p.m. Eastern Standard Time. If you have any questions, call 844-607-7283. You can also find us, the Senior Health Desk, on Facebook, or you can go on YouTube and search Senior Health Desk. Now, let's go through with our remaining time some of the other questions
I
that
wanted
people called in. Go ahead, pick one. We got plenty to choose from.
I wanted to cover one thing just because this is something that, it boggles my mind, and I just wanted to get it out there. So when I come across folks that just have original Medicare A and B with no supplement, no Medicare Advantage plan, it's if you don't have Medicaid, right, that's helping you pay the 20% that Medicare doesn't cover, it's a dangerous way to have your health insurance, because Medicare's original Medicare A and B is roughly 80-20 coverage with its applicable deductibles, right? The problem is that 20% that you're responsible for in original Medicare, there's no limit to that. So 20% of a big bill is still a big bill. So God forbid, I'll bring up my clients out in Montana that got ran over by one of her cattle. It was just shy of $1 million medical bill. Now, luckily, she had a plan, so she didn't pay actually she paid nothing for it, which was pretty awesome. She called to thank us, which I hang my hat on a lot. But the Advantage plans will come with what's called a maximum out of pocket. And most of the ones that I do anyway, are $0 per month that don't have a cost to them. So in most cases, it's like there's really no reason not to have an Advantage plan, even if you can't afford like a big expensive Medicare supplement that's going to give you 100% coverage. Even a $0 Advantage plan will come with what's called a maximum out of pocket. So the maximum out of pocket will limit how much you spend out of pocket. So if you are, just call her Mrs. Smith out in Montana that got ran over by her cattle and now has $1 million medical bill, let's say you had a Medicare Advantage plan that had a $6,000 maximum out of pocket. Well, you'd hit your maximum out of pocket, and that would be it. Your plan would pick up 100% of everything. Without it, you'd be on the hook for roughly $200,000. Big difference. Big difference.
These are some of the things that we as licensed certified Medicare specialists bring to the table, because I agree with you, there's absolutely no reason, if you're just on original Medicare, not to get some kind of a Medicare Advantage plan. It will limit your financial exposure. You'll know what your maximum out of pocket's going to be. Then you can tell us who your primary care physician is. We'll make sure they're in a network. We'll make sure we get your prescriptions covered, and we could probably save someone a lot of money if they're taking prescriptions. The Tier 3 and Tier 4 prescriptions can get pricey. Also, you'll have dental, vision, hearing. You might have trips to and from your doctor's office. One thing that people seem to get caught up on, which I understand but not really, it's this going to the gym thing. There's like a generic term, silver sneakers, which is not a specific thing, but it's gym membership. There's a lot of people that say, Mr. Munster, I got to go to the gym all the time. And you call them back 6 months later and say, so Bob, you've had this plan for 6 months. How's that going to the gym working out? And 99 out of 100 people go, well, it's like a New Year's resolution. I really, really wanted to go to the gym and get in shape, and then, the conversation goes wherever it goes.
Well, it's funny. I think that for people that, don't get a free gym membership, includes, no cost membership in their Advantage plan, I think I read it's something like 80% of gym members never go to the gym.
I only bring it up because it's something that people tell me they always hear when they get these commercials that are going to run incessantly this time of the year. Free gym membership. And then, like you said, if you really wanted to go but you don't really go, would you rather have a free gym membership or a plan that maybe had nothing to do with any kind of a gym membership but covered your prescriptions better, gave you some dental, vision? I mean, there's a lot of other benefits that are available, and I'm nothing against all of you that want to go to the gym. I go. I'm there 5 o'clock when the gym opens. I understand, but it's not for everybody. So don't just buy something because you're getting something for free. Get a plan that really is going to help. For those of you that are just tuning in, you're listening to the Mr. Medicare Show. Join us every Thursday at 7 p.m. Eastern Standard Time. If you have any questions, call 844-607-7283. You can also look for us on Facebook. You can search Senior Health Desk. Same thing with YouTube. You can go and look for Senior Health Desk. With the time that we have remaining, I think I wanted just to explain to people that they hear October 15th, which starts tomorrow, and December 7th. I mean, December, you think end of the year, and it's so far away. But as you and I know, that's going to go in like 1, 2, 3.
Yeah, it goes fast.
Before you turn it, it's going to be the first 2 weeks of the annual enrollment period are gone. We're in November. Then you turn around, it's Thanksgiving. And then there's 1 week left.
Then we're in December, and it's 1 week left.
And there's 1 week left. So what we're encouraging everyone to do is give us a call, 844-607-7283. We will schedule time, a time for a day and time that works for you. Some people work in the morning, or they run errands in the morning, in the afternoon. During this time of year, I make myself available basically early in the morning till 9 o'clock at night, 7 days a week. Matt does the same thing. Rich does the same thing. All the agents in our office would be more than happy to accommodate your schedule. So if you tell us, can you call me Saturday afternoon at 4, or Sunday at 7, or I work every day during the week and I only have weekends for my family, but can you call me Tuesday at 7:30? Whatever it may be, we want to let you know we're here to help you. The next 7 weeks, we've all cleared our calendars. Our families know they're not going to see a lot of us. We're going to be busy helping people. But you've got to call us, and you've got to let us know what's a good day, what's a good time. And please be ready with a list. What are the things people should have ready? We need a list of their doctors?
Yeah, so list of your doctors, list of medications, your red, white, and blue Medicare A and B card, and also if you are on Medicaid or receiving any kind of assistance as far as a subsidy, maybe a low-income subsidy to help pay for your medications. And these are some of the stuff we can check for you, so if you can't find it, give us a call and we might be able to help you dig that up. But that's the stuff that we need. So doctors that you want to have in network, prescriptions that you take, and pharmacy that you go to. And what else, Mr. Medicare? Red, white, and blue card. Oh, and Medicaid number. Medicaid card and Medicaid number.
Also, I want to let people know the last 2 years with COVID have just affected all of us in many, many ways. I know so many of my Medicare clients, one of their spouses has passed, or everybody has a family friend. I think it's over 700,000 people in this country have died, and I'm not going to get into politics, red team, blue team. All I'm saying is a lot of these plans that are going to be available for 2022, you have telehealth visits for mental health. There are so many things that Medicare is offering people of Medicare age to help you get through 2022. And with all the things that are happening, new vaccines, and younger people can be vaccinated. I saw the other day one company has a pill you can take, even that'll make life so much easier. Yeah. But we're here to help you. So our goal is to educate and inform you about Medicare. We want you to enjoy your life. We're going to be going nuts the next 7 weeks, and that's fine. We're ready for it. We will make sure you have the best coverage at the best price, and we're here to take care of you. We want to help as many people as we can. Please share this information with family and friends so they can join us every Thursday at 7 p.m. We're going to be here next Thursday, and we'll give you an update of how the annual enrollment period is going. But please tell family and friends, give us a call, 844-607-7283, the Senior Health Desk. Harold Solomon, Mr. Medicare, Matt, Rich, the principals of the Senior Health Desk, all our agents. We are ready, waiting, willing, and able to help you. Give us a call. Let us help you. AEP starts tomorrow. I don't know if Matt's going to sleep tonight. I know Rich is not going to sleep. He's ready to go. He'll be here probably crack of dawn tomorrow. He's ready. I'm ready. All our agents are ready. Give us a call. We're here to help you. Let's have a successful AEP. Thank you for listening. We'll see you next Thursday.
Thanks so much. Have a good night.